Namaskar, friends. Today we will see the insulin resistance stages and obesity, pre-diabetes, diabetes, and diabetic complications, and then other lifestyle disorders. So, friends, we've been talking about it. Checking glucose, fasting, blood sugar, and A1C alone will not determine our health status. What is more important is your insulin, checking of the insulin. See, what happens is that sugar levels and then A1C levels will be normal for many, many years despite an underlying problem. So that's what is very important to check. We discuss about this, why we get high glucose, why we get high insulin level over the year, why we become insulin resistant. Few videos are there, we will not dwell on that. See, by the time you learn about diabetes, that means you lost so many years, friends. First thing is your high insulin levels, there is no problem on health, but yes, you are into trouble. Next is resistance. Third is impaired glucose tolerance, that means pre-diabetes, and then you get all the heart problems and then the diabetes. So somebody who's already diabetic means he has already wasted so many of years of not knowing it correctly. So I have got three cases, friends. They're all my, some of them are my relatives. This boy is a 22-year-old boy, is my relative, and he is 81 kilograms. So when he came to Chennai, I took him for the test, these three tests. Look at his fasting sugar is 92, which is very good. What is the optimal? Optimal is below 99, so he is 92. Excellent. What about HbA1c is 5.5%? It's good. It's not even pre-diabetic. Below 5.6. See, up to below 5.6 is good, good enough. And when we check this insulin, look at this 24.49. It should be how much? It should be between 3 to 5 only. It should be there. But the lab is talking about 25 and also. So anybody sees this report, they think they're all right. That's another misleading thing, friends. So once we check this insulin resistance is 5.56. So the reason why this guy is not losing weight, he goes to gym regularly. Despite going to gym, why is not reducing? Because of the insulin. Because of this high insulin resistance, he will continuously feel hungry despite eating. So he will be compelled to eat many times. So now look at it. This is the stage one. So he's still his sugar is okay. Only high insulin is high, and then his HbA1c is okay. Suppose he shows this report without the insulin, doctor will say you're all right, but they don't know what is the reason for his weight gain. So another, we'll look at another case. This is a 16-year-old relative of mine, and when she came, we got this test done. Look at his HbA1c is 5.8%. At age 16, she is already pre-diabetic. Very sad. And then what is her insulin fasting insulin is 18.55. Look at it, very high. Look at fasting sugar is only 78. If anybody, many times, most of the labs they check the sugar and they say it's all right. They don't even check HbA1c. And then if they check HbA1c, they don't check fasting insulin. So we are not knowing the complete picture of that person. So she is also weight. She is 65 kg at 16 years. Look at it. What all why it happens, friends? As we discussed it, multiple eatings in a day, and then these people, especially youngsters, they are fond of drinking cool drink, and also they don't drink the cool drink at one go. They keep on sipping large and long number of hours. So that is the main reason for the insulin, high insulin production in the body, and high remaining high insulin levels for many many hours in a day. All this will cause the problems. Look at, she's in stage 2, right? Still she's not diabetic, she's pre-diabetes only at age 16. If she don't take care, maybe another 3 4 years she could be diabetic. Now we'll see another case. This is the third case, friends. This person was in some other group. When I saw he was taking insulin, in fact, in the group he has written he's already taking insulin. So when I asked his reports, he sent me. Then I asked him to get further reports. One is C peptide and fasting insulin. Look at friend. He's 10.7%. He's only how many years? This guy is 24 years. He's already in third stage. His diabetes insulin resistance 2.16, right? So what happened to him when his 10.7% is the thing, and his fasting sugar was how much? It was fasting glucose 108, but that day I think he got more. So they put him on insulin. He's from a village, so he went to the hospital. They put him on insulin immediately. So he was taking insulin for a few days, and then he put in the group that he's suffering from low glucose levels in the morning and is feeling miserable. So I got in touch with him, and then I got to know his case. And when I asked him to check his C peptide, which is good enough, 1.08 is good enough, maybe he needs something. So I told him to discontinue the insulin and then follow the lifestyle changes. And in a few days he was kept on sharing with me his fasting and the pp sugars after eating and before eating. and now he got rid of it. It's not that I'm trying to say something great, because at a so early age, it's not a complicated. He's only diabetic. Now, what happens if this guy continues the medication and goes about eating as advised by the dietitian, eat 5 to 6 times small meals? He's definitely at the age 24 itself. He has got this problem. He's going to get into bigger trouble. So what is the stage 4 and 5 friend? Sugar levels are high. Then fasting insulin will come down. See, we have seen that what happens over the years. If you continue to be a diabetic, and then your insulin production will come down. That's the where you will be subjected to outside the injection of the insulin injections. So friends, there is a great opportunity for all of us to know where we are. See, in fact, in my opinion, large number of people are in this stage 1. That means they are not having any high sugar, but they are already with high insulin, and they have already overweight problem. If it is ladies, is PCOD problem, thyroid problem, and all that. So I urge people to understand this particular, points, and then make changes, make get your test done and all such. Friends, these are all the people, great people who are giving great lectures in YouTube, and I spent a lot 8 years understanding from them, looking at various permutation and combinations, and based on this, I have created my own approach, my own understanding, and I have created two things, friends. One is, how do we assess your health? Somebody asks your weight, you know very well, you can go and weight your weight and tell us, okay, I'm 80 kg. Somebody says about your blood pressure, you can suppose I ask you, what is your health score? So nobody knows what is my health score. So I have created about 12 parameters and 30 parameters and all that. There are a couple of videos there you can check. So how do we assess your health score? So in fact, when I started this proposal in 2014, when I looked at my health score, it was hardly 8-9%. In a span of 4%, 4 months, when I followed these lifestyle changes, my health score has jumped 88%. That is the clear indication of improvement of the health, friends. These are the few people who have benefited by following this wellness secret daily schedule, friends. And I urge group members to pay attention, take the knowledge forward, and make use of in your life. And if you have any difficulties, you can always call me up. Friends, my name is Gangeshwar Rao. I am not a doctor, so please don't take my advice and stop medication and all that. Talk to your doctor. As I was telling you, these are the 12 parameters. This is what is the health score, friends. Thank you very much for listening. And knowledge and discipline are the gateways to health, friends. If you like the content, you subscribe to the channel and share to your friends, and then invest time in acquiring knowledge and be disciplined, friend. Thank you very much.